All right, we are back on Morning Line. Thanks for joining us on this Wednesday. Nick Barris along with malpractice attorney Clint Kelly. Good to have him on. And the phone line's open, 737-7587, if you want to join in the conversation. Clint and I spent some of the first part of the morning just talking about this report that came out. Again, if you're just joining us, the bottom line is the third leading cause of death in this country behind heart attack and cancer is?
Preventable medical errors. And how many times have you and I on this show talked about what are the main reasons for this? Lack of communication, failure to diagnose, failure to respond to an infection when it occurs in the hospital, and basically medication errors where a nurse comes in and gives the wrong medication. How many times we talked about that on the show? And this study right here incorporates all of this.
And what's crazy is, someone who suffers a heart attack or someone who's, dying from cancer, that's that just happens. His key word here is preventable. Right. That these can be prevented. And you get to the heart of why? Overcrowding in the hospitals, the rush for the bottom dollar, making sure that you earn everything as quick as you can and as much as you can by limiting whatever you can, cutting corners. The volume of people, short staff, all kinds of things play into it, right?
I think Joe hit the nail on the head earlier in the show. It may not be as simple as the way Joe said it, but I think that's clearly a cause. And like we said off air, Nick, we've got thousands of people coming into Nashville every month, but I don't see new hospitals being built. Who's going to take these people and provide care and give them the time and attention they need when the resources stay as limited as they are? Makes no sense to me.
When was the last time you tried to get in to see your dermatologist or to have it's a waiting line. It's ridiculous. I find a doctor that's maybe out in the way that's a good for. Dr. Bunton used to be, she went on Talk to the Town. She was a dermatologist. She was great. I remember calling to the hospital, say, look, I need to get in. I think I have some sun damage I need you to look at. Oh, we can see you in a couple months. Goodbye. I call Dr. Bunton, and she's out private practice on her own, coming tomorrow.
Right.
That doesn't exist much anymore, and she's retired, which I hate. She was great. I loved her. Let's go to Grady. Grady, good morning.
Good morning, Nick, and Clark County. We had a problem with the hospital. Went to Southern Hills and had a staph infection in my leg. The first time ever, they had me walk out of the hospital. Apparently they didn't have a wheelchair, or they didn't have anybody to walk me out. But we got down to get ready to get in the car, and the nurse said, "I didn't take your IV out." And I said, "No, we didn't." So we sat in the hallway there in front of all the pictures of the directors of the hospital and took out my IV. But then went to my doctor the same day, and she said, they should have never released you from the hospital. She sent me Baptist or Southern St. Thomas Midtown, kept me 4 days. At least they touched my leg, and in addition to giving me antibiotics, but they cut it on 3 separate occasions, and they did have a wheelchair when I went out. So I'll hang up and listen to y'all's comments on that, Dick.
That's one of those types of situations where fortunately Grady wasn't hurt bad, and I think that's also something that gets missed here. The article didn't spend much time on this, and I need to study the British Medical Journal article in detail to discuss this, but there are many medical errors that don't cause death, that aren't part of this $250,000 statistic, $250,000 person statistic,
but still harmed.
And so you get people like Grady who get what I consider to be substandard care, substandard treatment, but fortunately they don't get hurt really bad. And Nick, we were talking about how do you prevent this? What can you do as a patient? I think this study screams for patients and their family members to be squeaky wheels. We always say squeaky wheel gets the grease. Yep. Sometimes you just got to get in people's faces and say, look, I'm here. This is the kind of care I want to get. Where's my wheelchair? Where's this? Where's that? And press them for it. And don't let them make you feel guilty that you're asking for this resource, because you're paying for this care. Whether you're paying for it out of your pocket, whether you're paying for it through Blue Cross Blue Shield or Medicare or Medicaid, you are paying for this care most of the time. And when you are, you deserve to have certain benefits and certain care given to you. So stand up for yourself when you get in that situation.
And I was just thinking, in the ripples of this report, keep in mind what's happening within the legal profession with regard to tort law over several years. As we see this skyrocketing, if you're wondering what tort law is, well, you're better at explaining it, but essentially they're making it harder for people to sue hospitals or doctors, correct?
That's right. Two things have been going on
And
at
yet
the same
it's
time.
skyrocketing the mistakes.
More people are dying from preventable medical errors, yet the patient's right to seek redress in court has been going down and more limited.
And
as
I
time
think that
goes
is
on.
linked. I think that's linked. I know there's a lot of other reasons we've been talking about, but I think when a hospital or whatever feels that they can't really be held accountable because they're protected by these reforms, well, it's kind of like, oh, I don't think they really want to see people die, but they're not going to go the extra mile. Trust me, if you're worried you're going to get sued for $1 million and lose, you're going to take some extra steps to make darn sure you do it right. If that threat's not there from people like you, come on, you're going to trust big business to do the right thing? Are you one of those naive people? All right.
It is really ironic, Nick, that we've seen tort law or the ability to go to court for medical negligence has been restricted so much in the last 20 years, and yet over the last 20 years, preventable medical deaths have gone up substantially. That can't be a coincidence.
Right. And one of the things they fought for was the statute of limitations.
Correct.
1 year, which has closed out a lot of people from the ability to sue.
Right.
Let's go to Lucy. Hi, Lucy.
Hey, good morning, y'all.
Good morning.
I appreciate this gentleman coming on and informing people because you got to be informed. I want to say something, and then I want to make my segue into my point.
Sure.
You don't need but a fifth-grade education to understand what I'm about to say. You don't have to be educated to understand this. But since the late 40s, when they started pushing medicine for profit, the AMA was the #1 lobbyist in Washington, D.C. I don't know if they are today, but in the state of Tennessee, the biggest lobbyists are the AMA and the nursing home people. So you need to understand this is not your grandmother's medical model anymore.
Right.
This is corporatization of medicine, and look at it, it's all about the dollar. That being said, I think people need to understand, and maybe this attorney can explain the importance of this. Everybody needs, the first thing you need to do is set up a medical power of attorney that is in detail, because they're using that now to hide any mistakes they're making and possible access to stuff, for malpractice down the road, or to stop malpractice from occurring to your loved one or who you're in charge of. And that's all I want to say. If the attorney can comment on the importance of a real thorough whatever I just said.
The power of
I
attorney.
haven't had my coffee.
medical power. Lucy, great points. I really appreciate your call. Is there? I'm not sure. What's she talking about there? The significance of that.
The most important point Lucy made is just what she said at the beginning. This is not your grandmother's medical system.
No.
And she is right about the lobbying power of the Tennessee Medical Association, which is basically the Tennessee branch of the AMA, as well as the Hospital Association.
Every state's got one.
Yes, they do, and they are extremely powerful, and they are behind many of the restrictions that have been applied to our ability, the public's ability, to get our day in court when someone screws up on us and either injures us or kills us. As far as a durable power of attorney is concerned, every patient ought to have one, there's a lot of different reasons for that. Some people don't want to be resuscitated beyond a certain point or kept a vegetable, which makes perfect sense. You also want to have someone there making health decisions for you if you're incapable of doing it, and that person can also keep a record. Literally, you can take a pad and keep a record of what's being done to your loved one throughout the hospitalization to make sure, first of all, things are being done properly. But again, it's a way to keep a journal in case there is a major mistake, and that's really where we are right now, Nick. The knowledge is power. Patients as consumers now are going to have to start protecting themselves and their loved ones by basically keeping journals of what happens in hospitals, because they know, or now this study shows, 1 in 4 patients are going to sustain a medical error during their hospitalization. That's 25%.
Yeah, 1 in 4. That could be you.
Right.
It probably will be you at some point. Let's go to Ann. Ann, good morning. Hi, Ann. Are you there?
Yes, good morning.
Good
I'd
morning.
just like to make a comment. This is the first time I've ever tuned in for you and finding it most interesting. About 5 years ago, I encouraged my daughter to have foot surgery. she had insurance, and I knew that the insurance would be running out in a short period of time. Well, the surgery was done wrong, and when she talked to the doctor and said about the problems that she was having, he said, "Don't come back. I can't do anything for you," and cancel your appointment. Well, she continued to have pain and problems. She went to, I think, a couple of other doctors, and they said, yes, absolutely, the surgery was done wrong. And she said, "I don't want to make any money off of this. All I want is my foot fixed." And they told her it's going to be nearly impossible to have one doctor say anything against another doctor. So she talked to a couple attorneys and said, "What can I do just to have my foot fixed? I don't want anything but my foot fixed." And they said, "Well, we really couldn't do much of anything because it's so hard to get one doctor to say anything against another. And to bring in experts, the attorney would have to pay out of his pocket for them to testify. So I'm sorry, we can't do anything." So over the next thing you know, the time where anything could be done has run out.
Sure.
It's now 5 years later. She's in terrible pain because of the way that she walks. It has affected her knees, her hips, and her backs. And she feels that probably in about a few more years she will be in a wheelchair. It's just not right what's going on. It's just simply not right. Covering up for each other. And the doctor who did the surgery wrong is probably doing it wrong to other people too.
That's one of the biggest, and thank you for sharing. And I'm so sorry, but let's let me have Clint comment on that, because you bring up some really good points. Now, obviously, a lot of these people, when they're wronged or feel they've been wronged, they don't have the resources to go forward. Now, is it true it's difficult to find doctors to go after doctors?
It is, but that's my specialty. That's what I do for a living.
But there
I find
have to be good
doctors.
doctors out there that want to go after the scumbags that are doing it wrong.
Well, there are experts that will testify whether or not another doctor has departed or has not followed the rules. We've talked about the standard of care. Typically, those experts, though, come from out of state, and I have a number of experts that I send cases to who are willing to testify if they see a case involving bad care. I mean, they have no gumption at all of coming here and testifying. And that's my job, is to get them, pay for them, and be able to get that case to court and get it tried if it needs to be tried. The other point, though, she raised about the surgeon and this happening to other people more than likely. There are various statistics out there, but I feel pretty comfortable in saying that there's probably about 5% of the doctors committing about 90% of the malpractice.
Okay.
I mean, that's the truth. Most doctors do a very good job, are conscientious and prudent, but there's this small minority that seem to do it over and over again, and either because the hospitals keep them in because they're money generators, or maybe the hospitals don't truly know the extent of this person's bad pedigree, but they always seem to go from one hospital to another, from one city to another, and injure people. And I don't know, this study really doesn't address that, but I'm wondering what's going to have to take place before these doctors finally get run out of town and run out of practice. I mean, it's just bad.
That's great. And we should say, to Lucy's point in terms of finding an attorney, as you just said, you have experts that you know that can come in. They need to be paid. You take on a case on a contingency. And so you have to determine whether or not Lucy's daughter's case is one that is lucrative enough to, should you win, and you could lose, but should you win or settle, you have enough money to cover your fee, to get her some money, what she needs, and to pay for those experts.
And I'm just speculating, but that may be one reason why that case was turned down, was the fact that they didn't think, the lawyers didn't think that the case was financially feasible to bring.
Which didn't mean that her daughter wasn't wronged. It just means there wasn't the money there to pursue it.
There are a ton of patients who are wronged who simply can't go to court because the system is set up where people like me can't afford to take their cases.
And that's, I think, what Ann was talking about. On that note, we'll take a break. When we come back, Gene, Donna, and others, more of your calls in our final segment with Clint right after this. Stay with us.